Hello, this is Tiffany LePage. I'm a part of the medical terminology group for class 3033, section 52. This is my module 3 video for the role play scenario with the skin cancer treatment patient. Hi, Mrs. Andrews. My name is Tiffany. I'm going to be your nurse today. How are you feeling this morning? Yeah, no, it's okay to be nervous. I know surgery can come with a mess of emotions, and I know it can be scary. So I want to assure you that you are in great hands. We're going to do our absolute best while taking care of you today. So I just want to go over everything with you before we get started in case you have any questions for me or the surgeon. The procedure you're having done today is called Mohs surgery. It's to remove all of the tissues that contain any of the basal cell carcinomas. We will go through the procedure in stages. You will be awake, but we will use local anesthesia on the areas being worked on. So good news is you will be able to go home today after we're finished. Yeah, so we're not sure how long exactly it will take because every case is different. So we may have to bring you in for several rounds of tissue removal to ensure we got everything and that 100% of the tissue margins are clear and cancer-free. So the basal cell carcinomas are the type of skin cancer we're removing from your cheek today. They're abnormal growths that arise from the skin's basal cells in the epidermis, which is the outermost layer of the skin. They often develop on areas such as in your case on the face, where the skin is often exposed to the sun's UV radiation. Over time or after intense periods of sun exposure and having your skin being sunburned, this type of cancer can form. It is the most common form of skin cancer, and basal cell carcinomas usually remain localized in one spot. So like yours, in your case, it just remained on your cheek, but they can be destructive if not detected or treated early. So I'm very happy that you decided to come in when you did, so we can remove it all for you before it possibly metastasizes, which means spread to other places. So Dr. Toledo will be the surgeon performing your surgery today. He's a dermatologist that specializes in Mohs surgery. He will also be the one examining the pathology of each layer of the removed tissue to determine how many times he will need to bring you back in to repeat that tissue removal process. So basically, you're going to go into the procedure room. You may keep the clothes that you're wearing on. Dr. Toledo will examine, and he may even draw some marks on your cheek before beginning. And since we are removing tissue from your face, we'll have you lay down and we'll place a surgical drape over your face. So although you won't be able to see what he is doing, he will talk you through the entire process. He will also inject that local anesthesia around the area to numb it completely so you don't feel anything. If you feel anything at all or you feel uncomfortable, please speak up and let me or Dr. Toledo know. We want to make sure that you're as comfortable as possible during the procedure, and I'll be sure to be next to you the entire time as well if you need anything. He's going to use a scalpel to remove a thin layer of visible cancerous tissue. And then afterwards, I will place a temporary bandage on your cheek. I'll assist you to the waiting area so you can relax. And at that time, Dr. Toledo will be examining all the tissue in the lab. And if we need to bring you back in, we will. And the same procedure will be repeated just until the cancer tissue is 100% removed. So this is why we're not sure how long it will take, because it really depends on how many times we need to bring you back in. So it could take up to several hours. However, once you are all clear of the cancer cells, though, Dr. Toledo will close the wound up with stitches. So I know that, Mohs surgery does deliver the best cosmetic results, but there still is a chance that you may have a scar after your wound heals. So we'll be sending you home with some wound care instructions. It's a sheet of paper. It's got all the information on it, how to care for your wound afterwards. So just make sure that you really follow those instructions, and just take really good care of your wound. And that way the risk of scarring is really minimized as much as possible. So you will need to come back next week to have your stitches removed. What day works best for you? We'll go ahead and we'll get you scheduled now, so that way when you're finished with the procedure, you can just relax and head home shortly after. Okay, so do you have openings at 10 a.m., 1 p.m., or 3:30 p.m.? Perfect. So I will mark you down for next Tuesday, October 5th at 1 p.m. And do you have any concerns or questions for me before we get started? And that is all.